My name is Romwell Sabignano, and I just had my laminectomy with fusion um, at Kaiser Permanente this morning, the 1st of July. And I just would like to share with you my experience and how it went. Um, Last night I made my preparation, and on July 1st, I woke up at 3 o'clock in the morning and time to be there at the surgery. Preparation, got my clothes going, my car, and parking and all that stuff. I got to Kaiser around, I would say 5 o'clock, and my surgery starts at 7:30 in the morning. And the whole process took about 30 minutes for admission, and they will put tube you up, and with all those sensors to monitor your nerves. And I was seen by a neurologist and a neurology technician. Introduced himself, very very courteous and very friendly, and had a great impression of the had a great impression and expectation of the surgery. He said that the surgery will take about an average of about 3 hours, up to about 6 to 7 hours. And then later on, a neuro expert came in to introduce himself, and very respectful, very friendly, and I'm really very impressed with Kaiser Permanente Neurosurgery Department. And then after they tubed me up, in about an hour, I got all my verification of the surgery, the procedures, and all that stuff. And then I was told that within 30 minutes, they will pick me up and take me to the surgery department. And about 6 hours to 7 hours later, I woke up with no pain, with no issue at all, and not knowing what happened. And here I am with my brace, and I believe everything went well. I woke up with no pain at all, and I felt like I just went to sleep for at least 6 hours. And they put me on IV to prevent infection. I was put on general anesthesia to put me to sleep, and other medications so to prevent other further complications if in the event that there will be one. You know, this is a very complicated procedure, and so they took all the necessary steps to prevent any form of complications. When I woke up, I still have a little bit of tingling sensation on my hands, although it's starting to reduce now. I still have weakness on the legs, although I did my therapy already. The therapist came by about an hour ago and took me for a brief walking session to verify how far can I walk, and what's the degree of strength that I have in my legs. And later on, there were series of different types of doctors, neurologists that came by and checked on me. That was very nice and comforting, and they tested my strength on my arms and my legs and if there's any pain on my neck. I was super impressed with Kaiser Permanente, and given the chance to do it again, for sure I don't want to do it again, but if I had to, I would choose Kaiser Permanente in Montana, California. What else? Oh, I just got my meal after the surgery. I had water because I was super thirsty after the procedure. 3 hours later, I had my breathing test to see how strong my lungs are, and I was injected with different form of medications to strengthen my lungs and measure the value or the strength of my lungs. If you can see, there is a computer right next to me, and they verified my the strength of my lungs, and I passed. They also verified my heartbeats at 144/45, which is a little bit high, but it's very manageable, or relatively within range, or a little bit higher, because I'm in a hospital, and they said obviously I'm still under stress. So other than that, right now I'm in my room, getting ready for my real room, where I can be transferred for maintenance on my surgery, my cervical surgery. Oh, by the way, for some of you who does not know, I had a procedure called laminectomy with fusion, cervical laminectomy with fusion on the neck, and so it was a very successful procedure, and I was very impressed that prior to the actual procedure, after they prepped me out, my doctor came in and discussed any further procedures. What do I expect from the procedure, and how long it's going to be, which is basically a reaffirmation of what we discussed a few weeks ago, or more than a month ago, if I can recall, about what's going to happen with the procedure and all that. Dr. Goldman was my neurosurgeon, and he was a great guy. He has been doing this for practically more than 25 years here in the Inland Empire area. And his assistant was what's his name? Tim, who monitored my nerves and put me on tubes to find out what degree of what part of my nerves is being worked on, and how am I reacting to the surgery. It went well. I would say basically it went well. So right now, this is my first 4 hours from time of operation. and so far I'm doing great. I do not have a lot of pain, although I'm on tube that injects um, pain relievers and antibiotics, things like that to keep me going. Um, Other than that, it was a great surgery. And if you're to ask me about this is it's a brace, and it's from the hospital, part of the post-op um, um, post-op equipment that they will give you. And right now my pain is around 4, and because of the pain medication they have reduced it down to, I would say, 2 or 3. And I know I'm lucky right now to be comfortable. If without those pain relievers, I know it's going to be like at least 8 or 9. So um, thanks to that, I'm in a reclining bed, and it's almost 8 o'clock in the evening now, and I started doing this video around 1 o'clock or 2 o'clock when I woke up, and then I got cut off because doctors kept coming in and nurses kept coming in. So I just don't want to, for HIPAA reasons or HIPAA regulations, I don't want them to be a part of this, or their faces or their names without their permission. So without prior permission. So I kept editing and editing until finally I got this perfect scenario, just practically 8 o'clock in the evening. And right now I don't feel a lot of pain. I had a great nurse. Her name is Marielle, and she's very professional, very knowledgeable, and I'm about to fall asleep. And I'm also on a catheter, but without the number 2, so it's just a number 1. In the event that I would like to go pee, but I'm getting tired and about to fall asleep, so I will continue on with this YouTube video of my experience on my cervical stenosis surgery, which is the laminectomy of the laminectomy with fusion, and which went well. So to some of you, or to all of you who are doing this for the first time, I assure you it's going to be a breeze. You'll be scared. It's normal to be scared at the first hour, but once you fall asleep and they inject you with general anesthesia, believe me, you won't even feel a thing. You won't even feel a single thing. You will be asleep like a baby, and you will wake up like a baby, and you had a good rest. But of course, because of the surgery, you start realizing that, oh, okay, this is what happened, and you'll start feeling some pain and nausea and weakness. But other than that, you will do fine, all right? To all of you, some of you who are going to do this procedure, I encourage you guys to do it, and don't be afraid. As I said, God will be there for you and take care of you, as your doctors and your anesthesian and your neurologist are very knowledgeable in this procedure, and this will be it won't be a breeze, but it will be as comfortable or as manageable as you can. Good luck on your surgery, and I pray for your safety, and I pray for your surgeon and your healthcare professionals that they will be able to do this surgery on your neck in a very successful fashion. Take care. This is Romwell Sabiniano signing off for now. Take care. God bless.